Welcome, dear viewers, to our format on natural medicine. I was once approached by an association called Coimbra Protocol. This association has developed something revolutionary or a technology that they are using. They told me that I should talk to the chief physician of the Swiss Mountain Clinic about it. They know what it's about and I like to do that too. I invited them and we'll get started right away and talk about this protocol. Stay tuned. Welcome, dear Dr. Petra Wiechel. Thank you for being here. I just heard that it has something to do with vitamin D. It's not new, but why do you need a protocol? What's so special about this idea?
Professor Coimbra is a neurologist at the University of St. Paul. I got to know him personally a few years ago. He has done an incredible amount of research into the concept of autoimmune diseases, particularly multiple sclerosis. Today we know that every autoimmune disease has causes, and if we only start to do immunosuppression therapeutically, that is, to reduce the inflammation, then we have had no solution for people for decades, especially in the observation of multiple sclerosis. We try to get rid of them again and again, but immunosuppression therapy alone has a lot of side effects. Coimbra, the revolutionary, has observed that in the context of an autoimmune disease of multiple sclerosis, there is a significant disturbance in the vitamin D receptor. Vitamin D, as we all know, the cholecalciferol is formed by the body itself through cholesterol and then has to be activated by light. This vitamin D is responsible for 249 gene expressions in each cell. This vitamin D controls hundreds of thousands of immune reactions. This vitamin D as a hormone, it is falsely referred to as vitamin, has a key function for us humans. And if today, only through the localization of people as they live north of the latitude of Rome, the position of the sun between October and March, the UV light is no longer enough to guarantee a sufficient vitamin D supply to humans. In addition, and this is finally a little bit clear, such an enemy image of the sun has been built up in recent years and the height of the sunblock cannot be high enough. And we do not allow an active vitamin D production over a sunblock of 15 to 99%. This means that this is an accumulation of things that have brought people into a pretty dramatic situation. And Coimbra comes to the point at the moment that he has observed and researched, these are university studies, that these people in the conversion from inactive vitamin D to active, in the docking of vitamin D on the receptor. Because vitamin D serves every cell. It is as if you have a key and it is valid for 1,000 apartments in this house. That means without this key I can't get anywhere. That means it is a multiple event. And if this vitamin D no longer docks, then an autoimmune event also arises. And he has observed that when he sees people who had a vitamin D loss, and in any case he could not always see it in the vitamin D level, but he had to go on in the vitamin D metabolism and he increases the dose, then there is a greater saturation. Under the motto that the cell may not have a 100% loss of vitamin D receptors, in between there are others. But then you have to be like a sponge that is completely dry and you dip it in water. And now he can soak up, and then he has observed. And then he has observed that if he now goes from 5,000 to 10,000, from 10,000 to 20,000, from 20,000 to 30,000, to 40,000, then something happens. Why does something happen? And I am like that in my life as a doctor, that I always look where someone has success. And not to be part of this success, but to look for a solution. And back then I tried to get in touch with Coimbra. And he protected himself a bit there, because the world became conspicuous. He got thousands of people out of the wheelchair. And I didn't manage to get to him. And then there was contact with a young woman from Germany, who was with him, who stepped on her family doctor's feet. You go there with me. And both of them arrived there and took over this so-called protocol, which Coimbra set up medically. This is really a strict protocol, and it does not belong in the hands of a layman. And this protocol, after which she followed, I was allowed to get to know her. And she said, we have to bring that to Germany. We have to bring that to Germany. And in this contact we then found out that we as doctors, who we can count on our hands, who knew about Christina and who were also fascinated by this protocol, that we are very much alone. And then there was this beautiful experience that two colleagues, including the family doctor with Christina, brought it back again and asked Coimbra to bring this protocol to Germany. And Coimbra is a very modest person. And he said, why do you call it Coimbra? Call it differently. In any case, long story short, the first training cycles started, which I was also part of. And vitamin D as an important hormone has now ensured to achieve this balance. But of course you have to go up in the dosages now. And I have emphasized it twice. It does not belong to a layman, because, of course, for the first time in vitamin D substitution we still practice a little medieval. That means, for the first time it has not yet arrived to everyone, how important it is. I also mean colleagues. I am sometimes very surprised how many people do not even know. When I ask, how is your vitamin D? Then it always means I substitute, but they don't even know how the level is. For a MS patient 5,000 is simply nothing. And for one, completely sufficient, for example. That means, I have to have something in my hand that controls it. And the other thing is, of course, that the substitution of vitamin D requires a good preparation. Because it is not just about rinsing off a protocol by adapting the vitamin D dose to this patient, but also with respect and attention to know what prerequisites this body needs. And we regulate that in the Coimbra Protocol, in which we have parameters that we strictly control, in which we have to take an incredible amount of time to clarify this for a patient. Because the vitamin D in its function opens the doors of the intestine to absorb calcium. And because I do not have enough vitamin D in my body, it makes no sense to believe that the calcium gets to the place where it is needed, because the doors remain closed. And calcium is one of the most important minerals for the entire cell energy transmission, for nerve transmission and so on, because there are more and more doors that open up in the intestine. And if I am someone who has a high consumption of dairy products, of cheese, of quark, of yogurt, then of course I create a so-called hypocalcemia. And this calcium can only leave the body via the kidneys and thus create a very big problem because the kidneys can calcify up to stagnation. And it is always superficially said that this protocol is highly dangerous. And it is not at all, if I take the patient with me and if the patient is ready. I have experienced a patient who was really at the beginning with her MS and was very motivated and wanted to change something about things or wanted to know what she could do so that the disease would not advance. And then she had to give up on cheese and all these things, and then it was okay. So then Coimbra is not possible. This means that this is a commitment that you make as a patient, that you are informed about all these things and follow this protocol. And so this observation is not only from Brazil to Germany, but worldwide. In the meantime, Coimbra has of course made the effort and helped incredible people to partly return to their daily lives, to partly master life again, to put the wheelchair aside. And this is really a huge, huge, huge pioneering work. And I have made the observation that we here in Switzerland are currently a bit handicapped to carry out the Coimbra Protocol. There was an incident, and I actually just want to appeal to it. For example, I was trained as a Coimbra therapist and I still notice that Coimbra is an incredible help to bring back what has been created into balance and thus to positively influence the disease picture. And on the other hand, my path has gone much further because I want to understand why it was necessary and why things in my therapeutic work are even more important. Why did it even come to the autoimmune process? What can I do to improve this reduced metabolism, this reduced receptor blockade, and so on? So for me it's not that Coimbra therapists are Coimbra therapists today. They rarely work differently. They are here for that. And every patient needs 2 hours. And later on it might even be enough to introduce yourself to your Coimbra therapist once a year. There are still too few. But because we are always very superficial when it comes to medicine and then share it with criticism, it has become a bit of a discussion and a warning. And it gives people so many good things who are able to return to their life. They become insecure.
But you could say, in summary, that every MS patient would have a chance to approach a healing path by adopting such a protocol.
I'm not so sure if you can call it a healing path. Because we don't yet know how long it will take. We have known for 10 or 15 years how wonderful it will be. We can't predict 20 or 30 years. But at least it's something you always have to start with the cause and also treat the causes, but it gives incredible feedback. There is the disturbance. And autoimmune diseases were very rare 20 years ago. Today we have over 70, 180 autoimmune events. And Coimbra has observed that, for example, patients with scabies, patients with psoriasis, partially neurodegenerative diseases, vitiligo, white spot disease, that was no longer an issue. That was still the case with MS patients. And suddenly they didn't have vitiligo or psoriasis anymore. Those were incredibly valuable observations. With 10,000, 20,000 or 30,000 units per day, nothing happens. Those are doses that are already in the hands of medicine. But when it comes to 300,000 units per day, that means the patient really has to follow up. I don't want to say castration, because I'm always the one who says, don't complain about the deficiency and see the wealth. But that depends on the individual. And I can repeat again and again, there are also things that disturb a Coimbra Protocol, that make it shaky. It's not just about following up, but also not clearing up stress in one's life. We always warn against that, especially MS patients, who are usually more susceptible to in everyday life. But as always, I'm incredibly happy that there might be a conversation here with you, with people who have experienced it.
Yes, the ladies are all coming. I'm so happy. In 4 to 5 days the MS Hut 10 come.
And we are really very, very rarely occupied. But you will see, a lot will then complement each other.
I somehow have a feeling that the D3 topic is a bit of a knowledge resistance that has been built up there, right? You know so much about D3, I think also about the countless studies that exist worldwide this year. It's a resistance, isn't it?
It's a big resistance.
And how is this resistance justified?
I can't tell you that, Alexander. I really can't tell you that. I think there are so many finished things that we doctors learn today, and then we have to flush them out. You have to go left and right and you have to deal with things. It's not just about the immune system. In children, the development of vitamin D deficiency from type 1 diabetes is scientifically recognized. And this child came from Germany. They are no longer 7 years old today, they are 2 years old. And I asked the family doctor, the pediatrician, so that when the child comes, it's not just a matter of strength but a financial one for the parents, that we shorten everything temporarily, but they bring me the things that are important. It was not possible. It was not possible. The pediatrician refused to accept these things. He wouldn't consider that important. And among other things, that was also vitamin D. And it wasn't important to him. And so far no one has been important, not even when the child was stationary.
Didn't something happen somewhere? If I look back now, when I was a child, when I was a little baby, there were only D3 drops from the baby age. And later, for example, I got these cod liver oil capsules. So this knowledge was there.
You know, there was also this knowledge. Every kindergarten child and school child always got a worm cure. This is the wonderful basic work of the family doctors. That has survived. We just said goodbye to life a bit more, I think, medically, because we take something as given. And because it is given, it now needs therapy and we solve it from all processes of how it was created. I think that's a little bit of the development in medicine, that we are no longer really aware of the causes and the basis. And that's how doctors are trained also. It's just sad, the whole question of automolecular medicine. There are also own training cycles today. But that has to be a basis. That has to be a basis in a medical study, when I go into my life as a doctor, that these things are also important to me. They are, if you already do a so-called checkup, never expected in the field of work of a doctor.
It's unimaginable. There are also the school medical guidelines for the D3 levels. But that you don't measure them is actually strange. And if you do, we can see that it is always dramatically in the red area.
Yes. And recently I had a patient who had such a terrible depression and a vitamin D level in nanograms 70 to 170. So I would have liked her to have a high vitamin D. No, 24. And I gave her 300,000 units of injection that day and the next day she came and I thought I turned on the light. She came and shone and said, "What happened to me?" And we know that, vitamin D and the emergence of depression.
So everyone who has a bad mental state and feels depressed should be tested first.
At least. And then I thought, vitamin D, what is it? It's light, it's light. And communication in us is no longer possible. One goes there, the other there. And an autoimmune story needs even more. But it was really nice how she was so unbelievably happy. It doesn't always happen so intensely, but I thought so. And I think such a doctor would say, for God's sake, not 300,000 units. Yes, of course, but especially you wait until Christmas next year until you slowly get it up to 2,000.
And then you have the depression. And then it's as if the 2,000 don't go away every day. So measure a lot.
I always say in March and October. And I have no problem if there is a good saturation, that you say, I'll take a break in the summer. But at the latest in September, October, I say, look, where am I? Have I made enough reserves? But you're long gone, because you said recently, yes, I take 10,000 a week. Hello. I need 1,000 a day at 4 to 5 years. So these units are much too low.
There was an increase made from 2020 to 2021 from 800 units a day to 1,500. You're laughing. Somehow it's really still a sad game with the D3 level.
We know that from the study. 30% less mamma CA, prostatitis, etc. And we don't have it in the basic care. Because it has to be important for a GP to check that with you. And again, I appeal to everyone, let them do it. And if the health insurance doesn't cover the bill a 1,000 times, but they do, it would be important to me. So that I know that about myself. And when people say, what should I know at least once a year? My budget is not very large. But hello, vitamin D. And that just doesn't work anymore. I mean, I'm out in the garden every day. Frightening sometimes, but how little vitamin D saturation.
I mean, what else is in the sun? Maybe the hands.
"20 minutes, but then please in the Eva costume or Adam costume. That's up to 10,000 international units that are activated there in 20 minutes. That's okay for now. And I can never do that about nutrition with avocado or egg yolk or whatever. The best solution is light.
Again, you said before, 30% fewer tumors are possible. Voice, Victoria, because vitamin D goes like a police through the body and that recognizes tumor cells and activates the natural killer cells. And they start off and solve the problem. But if you don't call it off, if you don't keep the activity up, then there's no one watching out for you. You gave the tumor such a negative touch. You evil, you want to destroy me. That's a despair of an organism that has never been clarified before. Because every day such cells are unfortunately there. Also with me and you when we get up early. But the immune system recognizes them, but it needs its prerequisites. And if it's not important to us to worry about it, and we've got this world here pretty unfriendly vitamin D. We have offices that can no longer open the windows. We don't go out anymore. And life has actually been adapted differently for centuries. People were in nature, worked there. And these topics are unbelievable. That's really the basis. And then you don't have to start to believe you can protect yourself against something better with a vaccination. No, it's not possible to be attackable if you have a high vitamin D. Yesterday, there was also someone who told me that there was a published study on the new virus in connection with high-dose vitamin D3. And there was nothing left. I also found it amazing that no topic was made about it. Although it's a study by Lenslet, it's actually incredible. Again, 30% fewer tumors. We know people over 60. Very often they get the diagnosis with a very high probability to get this tumor in the next 20 years. So it would be an incredibly important preventive measure for all of us.
What do you think the frequency is to get a tumor disease in the course of your life? In the population 1-2?
I thought over 50 years it's almost 50%.
Yes. And it's taking my breath away if we don't finally take care of the things we know. It's a bit of the medieval times that it's still not important to us today. How long will it take for poor people to lose their self-protection? And how nice, Alexander, that you're carrying these messages of self-confident, self-responsible people out there, who then also demand this from medicine, if it's important to the GP even if they don't know, right?
Absolutely. Thank you. Let's do the challenge to you, dear viewers. Go to your doctor and let him determine your D3 level. Look at the results. How much and how little, and can you orientate yourself on the upper end right?
Always. And it's a slow process. And not as a bonus at some point, but daily. And usually under 4,000, no one goes into winter.
But the doctor should determine how much he lacks, how much he needs. Now you have to take 20,000 units per day.
Maybe, yes. But it can stabilize slowly. 70 kilos, 4,000 must be the basis for the winter.
And for those people who are confronted with MS, they should perhaps deal with a Coimbra Protocol.
Yes, and above all, no self-shootings.
Always with an expert. Good. We will post this word Coimbra Protocol on YouTube. Also a link to this association, which wants to spread this idea and this protocol to the world. If you know anyone who has MS or such diseases, just point out that there is this Coimbra Protocol and that we simply encourage these people that there are possibilities. There is always hope, there are always solutions. And that it's D3, I think that's just phenomenal. Back to nature, it's light. Thank you very much, Petra. It was a very valuable interview again. We would have liked to start the other way around. First with these tumor diseases, then to D3 and then to Coimbra. Because there was some key information here. Thank you very much. All the best, see you next time.